41 new cases of COVID-19 has been reported by the Nigeria Center for Disease Control. The figures released by NCDC indicates that 43 are from Lagos, 8 Sokoto, 6 Taraba, Kaduna and Gombe, 5 cases each. Ondo, FCT, Edo, Oyo, Rivers and Bauchi states have 3 fresh cases each, while Osun has 2. Akwa Ibom, Bayelsa, Ebonyi and Kebbi 1 case each of the new reported cases. With this development, as at 11:50 p.m. on the 26th of April, there are 1,273 confirmed cases of coronavirus in Nigeria. 239 recovered from the infection, while 40 deaths were recorded. President Muhammadu Buhari has received a COVID-19 update from Minister of Health, Usagi Hanire, and Director General of the Nigeria Center for Disease Control, Chikwe Ihekwazu, on the rising number of confirmed cases of coronavirus in the country and how far efforts to stem the tide had gone. State House correspondent Jide Onifade reports.
With so much effort being put in by the federal and state government in the fight against the coronavirus pandemic, the number of confirmed cases is daily on the increase. So many questions are arising from this, such as if the country is winning the fight or what other strategy can be employed to tackle effectively the pandemic that has left thousands dead across the globe and devastated economies of nations.
The fight is going on very well. As I said, all countries are continuing with the struggle against corona using the strategies that they have developed for their own countries. We have developed a strong strategy here, working with all our expert groups like the NCDC and all the other port health services and so on. So we are working also with the states and the governors.
These are some of the questions Minister of Health Usagi Hanire and Director General of the National Center for Disease Control, Chikwe Ihekwazu, would have to provide as they arrive at the presidential villa to brief President Muhammadu Buhari, who is showing so much concern on the form the virus is taking to ravage the country. You want to let us?
Yes, we have given a technical recommendation from, first of all, from the medical point of view, and we have also brought the overall summary and position of a presidential task force, which, as you know, comprises of not only the health ministry but other ministries, and we have aggregated the opinion that we have, weighing the health and the social and economic factor and everything.
Minister Hanire also speaks on measures being taken to address a mysterious disease outbreak that has left many people dead in Kano State.
Kano government is doing quite a good job, and the situation is such that if the war is getting too big, you need more troops. So we want to go to join and support them in the great effort that they are making in Kano.
Everybody is working very hard to solve this problem, because we know that testing really is the bottleneck at the moment into increasing the number of people that we can afford care. But it's a complex process. There are no easy solutions. I can see that some people are already procuring rapid diagnostic test kits. They don't work, as far as we know. So I really recommend that we all stick to the national strategy, build on it, support its expansion, and together we'll get on top of this.
Twice, the president had ordered a lockdown in 2 states and the Federal Capital Territory to curb the spread of the coronavirus. But now that close to 30 states have recorded index case, will there be another lockdown after the expiration of the ongoing lockdown? This is what the president will decide during the week. From the presidential villa in Abuja, Jide Onifade, NTA News.
3 new cases of COVID-19 have been confirmed in Ondo State. This is apart from the infected police officer who came in to the state capital, Akure, from Lagos. Governor Oluwarotimi Akeredolu announced this, that the security of the state boundaries will be heightened to resist incidents of community transmission. Olubukola Aduwo reports.
Announcing the new cases of COVID-19 in the state on his Twitter handle, Governor Oluwarotimi Akeredolu said the number of coronavirus pandemic patients in Ondo State is now 6. One of the 3 new cases, the governor said, is one of the suspected killers of late Mrs. Funke Olakunrin, daughter of Pa Ruben Fashoranti. He announced that contact tracing of police officers and others in the SARS facility where the accused person was kept has commenced and the specimens collected for testing. Describing the manner in which the infected police officer came into the state from Lagos State as reckless, Governor Akeredolu explained that the officer was tested of COVID-19 in Lagos, but out of his own volition traveled to Akure while awaiting the result of the test. The policeman later went back to Lagos for treatment after his test returned positive. He alleged that he waited in vain to be picked up by the Nigerian Center for Disease Control (NCDC) in Lagos before he decided to move back to Akure to seek treatment. In the meantime, a professor of virology and immunology at the Federal University of Technology, Akure, Professor Abayomi, has said that viruses cannot be completely wiped out as their reservoir can also lead to resurgence.
I foresee a situation that in the next anytime from 3 months and above from now, a larger percentage of the population, even in Italy, US or something, would have developed some natural degree of immunity, such that the way it's giving its own knockout effect now will start going down.
Professor Abayomi Adebayo stressed that various measures to control the spread of the deadly virus should be strictly enforced by government. In Akure, Olubukola Aduwo, NTA News.
And from Ondo, we head to Osun, where 2 deaths have been recorded from the coronavirus from the new confirmed cases in the state. Governor Gboyega Oyetola made this known in Osogbo while addressing journalists. Femi Afaragun reports that with the 2 deaths recorded, the state currently has 13 active cases.
The 2 deaths are the first to be recorded from COVID-19 in Osun State since the discovery of the index case about a month ago. 3 health workers are also among those that have tested positive to the virus in the state.
Sadly, 2 of the cases are dead. One in Ife and the other one in Ede. Of the 12 cases, 6 are returnees from Benin Republic.
Governor Gboyega Oyetola is not happy with the way people are sneaking into Osun State despite the lockdown, attributing it to a high number of cases now recorded in the state.
We want to appeal to our security agencies to please do their work. Henceforth, we will not allow lorries claiming to transport foodstuff to come at night. I want to use this opportunity to appeal to our residents to stop encouraging families and friends from outside the state to return home. Doing so will further endanger the lives of those in the state.
With the discovery of additional 2 cases, Osun State now has 13 active cases of COVID-19. In Osogbo, Femi Afaragun, NTA News.
Kano State Governor Abdullahi Umar Ganduje has directed the State Ministry for Health to conduct a thorough investigation into the immediate and remote causes of the deaths recorded in the present time. In a statement, the State Commissioner for Information, Muhammad Garba, said although investigation into the cause of the deaths is still ongoing, preliminary report from the State Ministry of Health indicated that the deaths are not connected to the COVID-19 pandemic. He added that reports from the State Ministry of Health has shown that most of the deaths were caused by complications arising from hypertension, diabetes, meningitis, and acute malaria. He further stated that Governor Abdullahi Umar Ganduje is earnestly waiting for the final report from the State Ministry of Health so as to take necessary action. As the coronavirus pandemic claims more lives across the country, some are recovering from the dreaded disease. About 3 persons have again been discharged from the isolation center at the Ibom Multi-Specialty Hospital, Uyo. Susan Asukwo reports.
It is no longer news that the coronavirus pandemic has claimed and is still claiming thousands of lives daily across the globe. Hence, anyone who survives the infection deserves some celebration, and this is what the state government did for pharmacist Ememebon Gabriel and Dr. Otobon Asukwo, who have been discharged after surviving the dreaded disease.
Then I knew the cardinal sign of COVID-19 was just cough, dry cough, fever, and the rest, and I never had any. When I lost the sense of taste and smell, and I was confused, I boiled chicken in my house and I couldn't perceive it. I'm going out into the world. I have to protect myself so that I will not be reinfected. So you don't stigmatize, because this is something you can pick on the surface. You can pick through cash.
The Commissioner for Health, Dr. Dominic Ukpong, who is the incident manager on his part, gives an update on the progress so far made by the state in fighting the virus.
We sent 31 samples for tests. They came back with one positive new case, and we have discharged 3 today.
While Nigerians pray and hope for an end to COVID-19, the emphasis is still on everyone taking precautionary measures to avoid community spreading of the virus. In Uyo, Susan Asukwo, NTA News.
It's day 14 of the second phase of lockdown, and Nigerians wait for the next line of action. What is the current status of the Abuja metropolis? Victor Azu went to town and now reports.
As the second phase of lockdown nears its end, it appears that the desperation of Nigerians to flout the directives intensifies. There is, however, a commensurate resolve on the part of security operatives to enforce compliance. At the Galadimawa axis of the FCT, security operatives are seen screening vehicles to ascertain their qualification to be on the road. They have these apprehended ones to show for their efforts. They better be able to convince the magistrate otherwise. At the Nikon Junction, another team is doing due diligence. Some offenders have already been arraigned before a magistrate and their fate determined, I am told.
The cases we had in the mobile court today is about 25, you understand, and 5 of them were actually charged and then fined, and about 13 of them were committed to community services, and 1 was discharged, and some others were adjourned. On our parts, sit down at home. Within some hours, if this thing dies down and we don't have cases again, the better for us.
As the clock ticks towards Monday night, will it be an extension of lockdown or a return to normalcy? Only time will tell. In Abuja, Victor Azu, NTA News.
The clock is indeed ticking, and joining me now in the studio live from Borno State Capital is the Commissioner for Health, who will give us an update on the situation in the state. Dr. Salisu Aliyu Kwayabura, can you hear me?
Yes, good afternoon. Thank you for having me on your program.
Thank you for joining us. So there's a report alleging that 2 COVID-19 patients escaped from the isolation center in the state. How true is the report?
Well, unfortunately, that is absolutely not correct. We never had any patient from the isolation center that escaped. However, what happened was we had 2 patients who were reached out to after samples were collected by the surveillance team to explain to them the position of their results and then take them into the isolation center for further management. And then somebody somewhere ruled out this news that people have escaped from the isolation center. However, I can confirm to you that as we speak now, we've been able to trace these 2 individuals, we've been able to cancel them, and they've both been taken into the 2 isolation centers we have across the state.
States of the isolation centers in your state. How would you rate the isolation centers in your state, sir?
Well, our level of preparedness has been very good. You may recall that even before we had an outbreak, we were one of the best prepared centers in the place. We have a 100 bed capacity isolation center at the Brigadier Bakari Memorial Hospital, which has about 15 ventilators, a couple of staff, and a laboratory to support it. And the University of Medical Teaching Hospital will also have that bedded facility with about 8 ventilators to support the services in that place. In addition to that, we have a couple of trained healthcare workers, including nurse intensivists, anesthesiologists, as well as respiratory physicians to look after these patients.
Okay, thank you so much. Looks like you're doing so much to curtail the spread of the virus in your state. But talking about testing, we know that's a main way to nip the virus in the bud, getting people tested early. Would you say that you're doing that?
Yes, we believe we're doing that because our surveillance teams have been working around the clock, tracing all the contacts to the positive cases and also looking in the community. You may wish to recall that just about a week ago, the NCDC activated the reference laboratory for COVID-19 here in the Medical Teaching Hospital. At the state level, we also have some of the facilities, including the biosafety chambers, and at the moment the state is increasing the capacity by procuring a PCR machine with all the necessary test reagents. We are looking at increasing our test capacity to over 500 per day in the next couple of weeks.
All right, thank you so much. That's the Commissioner for Health, Borno State there, Dr. Salisu Aliyu Kwayabora. Thank you for joining us. You're watching Panorama live on the network service of the NTA. The news continues after these messages. Do stay. Thank you for staying. The Director General of the National Institute for Legislative and Democratic Studies, NILDS, Professor Abubakar Suleiman, has set up a technical committee of experts on COVID-19 to develop legislative and policy proposals for consideration by the National Assembly. In a statement, Professor Suleiman notes that this step becomes imperative to assist the Nigerian government develop a robust exit strategy that outlines steps needed to be taken to reopen the nation's economy and health towards curtailing resurgence of COVID-19. The committee, which includes economists, political scientists, and medical experts, will also produce a legislative framework for consideration by the National Assembly upon resumption. In a related development, Professor Suleiman has also commissioned a study to, among others, examine the relationship between pandemics and political economy and highlight short and long-term measures to avert this and future crises. The coronavirus crisis has raised important questions on how worsening economic crisis is intertwined with pandemics. It has also exposed the daunting deficiencies of public health systems and threats to industries, supply chains, and stock markets. Contributors to this study will include experts, practitioners, policy makers, and academics from all sectors. Findings from the study will be presented to the leadership of the National Assembly in August 2020. Now, the House of Representatives is set to reconvene plenary on Tuesday, the 28th of April, 2020. A statement from the House Clerk, Patricia Gewa, indicates that guidelines approved by the federal government and the Center for Disease Control, including additional guidelines developed by the House, will be communicated to members. The statement, however, directed staff and members' aides to work from home, as they will be notified when they are needed in the office for any special assignment. As Nigeria continues to battle the coronavirus pandemic, the Osun State government says it will begin enforcement of compulsory usage of face masks in the state from first day of May 2020. The state governor, Akwa Ibom, disclosed this while addressing journalists in the state. He said violators will be arrested and made to spend 14 days in an isolation center. The report.
When Osun State recorded its index case of coronavirus, both federal and state governments have been working tirelessly to contain the spread of the disease. Some of the measures introduced include maintaining of social distancing, practice of personal hygiene through constant washing of hands, use of sanitizers, and wearing of face masks. Governor Akwa Ibom says to further curb the spread of the virus, the state government will begin to enforce compulsory use of face masks from 1st May 2020.
We will arrest you if you don't wear a face mask. Because, in fact, when we arrest you, we'll take you to an isolation center. Because we will believe that you want to intentionally inflict or afflict someone with COVID-19. That's why you're not wearing your face mask. So we are taking isolation that we isolate you for 14 days, during which we make you do community service. So, in your best interest, please ensure that if you are going out, you wear your face mask.
He advised residents to comply with measures put in place to prevent further spread of the virus. The governor congratulated Muslims for the commencement of Ramadan and urged them to pray for the country.
State Command of the Immigration Service says despite the porous nature of the state's borders with Cameroon, it remains alive in ensuring both legal and illegal routes are properly sealed to prevent any possibility of importing coronavirus and other unwholesome activities into the country. Bikosu Abubakar tells us more.
Mawa is one among the states that shares border with Cameroon Republic, which has different routes into the state, thereby making it porous, as almost all the local governments has a foot passage into the state. This remains the contributing factor for smuggling, illegal entry, and other unwholesome activities that may lead Nigeria into some challenges. Just recently, packs of diazepam drugs, which has not even registered in Nigeria, have been confiscated from a Cameroonian who has the intention to sell it in Adamawa. Already, the Immigration Service, National Agency for Food, Drug Administration and Control, and National Drug Law Enforcement Agency have concluded investigation to ascertain the health status of the suspect and repatriated him back to Cameroon to avoid the escalation of coronavirus in Nigeria.
If not for the resilience of the patrol we have been doing, this Cameroonian will have find his way to this country with these drugs.
The Adamawa State Command of the Immigration Service has intensified patrolling all the borders so as to ensure Adamawa is free from any sharp practices. In Yola, Bilkisu Abubakar, NTA News.
Ekiti State Government has confirmed the abduction of the Commissioner for Agriculture, Folorunsho Olabode, by suspected bandits on Sunday. In a statement by the Commissioner for Information, Muyiwa Olimuluwa, the incident occurred while the victim was on his way from Ado-Ekiti to his hometown in Iye-Ekiti, Ileje-Meje, local government area of Ekiti State. From initial reports, the kidnappers shot one person in his entourage, the driver of the vehicle, and one other person. The statement added that Commissioner of Police in Ekiti State, Amba Asuko, has confirmed that a team has already been dispatched and are on the trail of the abductors. And that's Panorama today. Many thanks for watching. Enjoy the rest of your day.